Okay, kia ora everybody, Trev here with Dr. Lloyd Clarke, and man, this is going to hurt a little bit, but I'm going to be really honest. So I was probably over 170 kilos, I don't know exactly how much. I'm now sitting around 130, lost 40 kilos in program, but before I started the program, I went to see a gastric bypass specialist, okay? And so we sat down, he said, this is what I can do for you, and I can do it. It's going to cost me $23,000.
Oh, man.
And my insurance company was really polite. I can't say how much they were going to support me with that, but it's a lot of money. It's a Harley Davidson. And I left there just thinking, man, that's a lot of money, a big commitment. Should I do it? Now, for whatever reason, I didn't follow through. I got introduced to the program. I jumped on the program. Bang, 40 kilos later, here I am. But I want to just maybe get some medical opinion around, with what you know about the program, Lloyd, should I go and run off and get the surgery, or should I maybe give this a go first? What would be your opinion?
Let me first of all validate my answer by saying where I practice medicine, 21 years, Cardston, Alberta was the vertical banded gastroplasty capital of Canada. Two surgeons, Dr. John Hollingsworth, Dr. Burns Larson, took the procedure, and they were very successful at perfecting it and helping a lot of people. So I have assisted in that surgery hundreds of times, and I've assisted on the primary surgery and the revision gastroplasty surgeries. And I've seen people with obesity for 21 years. Now, I'm not going to tell you that that surgical options don't work, but they're very radical. And the irony of a surgical option for weight loss is most of those gastroplasty surgeons or weight loss surgeons will say, you come back to me when you've lost this much weight. And the irony of that is, if I could lose the weight, I wouldn't be here in the first place. But that's what they say. So here's some of my thinking about it. This program will help you lose the weight, and then you won't need to spend that $20,000. And while you may not fit on a Harley at the beginning, you will halfway through when you've lost 40 kgs, and that Harley will look really good underneath your butt as you ride down the highway, and you'll feel great. So, does surgical weight loss programs work? Yes, they do. But there's one key ingredient that doesn't happen with surgical weight loss programs unless you have a lot of the added features that some surgical weight loss programs don't have. And that is relearning discipline, which we talked about in one of the previous videos. But what this program does is it provides you with a format to teach yourself to be stricter about your eating habits. And when you learn that psychologically, then you can say, yeah, losing weight is easy because I'm not miserable doing it. And you get success, so it builds upon itself. Now, the problem with surgical treatments for obesity is when they band the stomach and they create a small stomach pouch above, if you're not careful and disciplined, you can expand that small new stomach to be another big stomach with a connector to the other side of the stomach. And therefore, you've just reversed the surgery because your new stomach can be capable of holding a large volume again. Therefore, all of those sensors in your stomach that say, I'm full, are gone. Which was what the surgery was about, was creating a small stomach that would tell you you're full before you ate too much food.
So let's say I have gone and had the surgery and I've reverted back, or I've gained weight back, and I'm thinking, should I do this program? Will this program work for me or not? What would you say?
Well, the first thing about that is that's an unfortunate experience. And a lot of people psychologically come to the obesity situation saying, I've just failed at one of the most radical things I can do. I have no hope. So there's a lot of depression and sadness going on when a person reaches that point in life, which makes me feel sad that they've got there. But there is no need to think that there isn't hope, because this program can give you hope and can help you lose weight. And it can start right from the first week. Once you start on program, you stick to it, you gain the discipline it takes, but there's no anatomical or physiological reason why you couldn't go on program despite having had a gastroplasty or any other type of surgical weight loss treatments.
Awesome. Oh, well, that's great news, and you're so right. One of my buddies, 203 kilograms, went to the specialist, same as me, saw the surgeon, and he says, if you were 150 kilos, I could perform the surgery. And my mate's like, if I could get to 150 kilos, I would never see you again. Well, he's at 160 kilos.
There we go.
And he's on track. So if you're thinking, should I, shouldn't I? Give us a go first, whānau. No te ora.